President Cyril Ramaphosa has announced several measures to curb the second wave of infections with regard to COVID-19. They include beach closures and limited alcohol sales. For reaction to this story, we're joined by public health medicine specialist Kerrin Begg. A very good morning to you, Kerrin. I mean, we've seen the numbers going up massively. We're getting around 8,000 infections a day. We know that we are officially in the second wave of the COVID-19 virus. Is the medical system, the healthcare system, ready to take on these new patients that will be coming in?
So I think that that's obviously our biggest concern, and that's why the President made the announcements for restriction both of movement and of gatherings, because the rate of increase has been incredibly steep in this second wave. We have already exceeded, I think that people need to know that, we've already exceeded the peak numbers of the first wave in both the Western Cape and the Eastern Cape. And KZN and Gauteng are well on their way to reaching their peaks as well, so of the first wave. So and the second wave is likely to exceed that of the first wave. So I think those are absolutely our concerns, is will our health systems cope that are already strained? Our healthcare workers are exhausted, and we really just need the space and capacity to pace the admissions. And remember that COVID admissions, whilst many people have asymptomatic or very, very limited symptoms, those that are sick get really sick and need a protracted admission with intensive care. And so extensive nursing, etc., occupying a lot of resources. So our concerns absolutely are for the healthcare system right now.
And Kerrin, it is no secret that alcohol consumption also puts its toll on the healthcare system. We see more trauma cases, we see more car accidents. So the changes in terms of the regulations on alcohol sales, will that go a little bit of a long way in helping the pressure on the system? Absolutely.
So we were able to show exactly how trauma unit cases dramatically declined after the alcohol ban and alcohol restrictions in the first wave. So that's probably one of the most important factors that measures that the President has put in place now over the festive season. It may feel like a bit of a dampener, but we really need to all be playing our part to make sure that we're responsible. He hasn't banned alcohol completely, so we can still enjoy a glass or two every now and then. But the idea is really to stop the binge drinking and the partying into the late hours of the night, where inappropriate choices start getting made. People stop physically distancing, so that they're making that. It has two impacts. One is on COVID and infections, and the other is on trauma. And so if we can reduce the trauma load on our hospitals, that makes a huge difference. And, of course, at the same time, we're trying to reduce the COVID load as well.
Yeah, and we do know that as we speak, currently hundreds of healthcare workers have been infected with COVID-19 while out on the front line. As you said, we've already reached the peak. We are in the second wave. Just, are they well protected?
So for the most part, I think healthcare workers are very well protected. We now have a lot more knowledge in the second wave about how transmission occurs and how to prevent it. And just to be clear, whilst there are some infections within the workplace from patients to healthcare professionals, the vast majority of healthcare workers are infected in the same way that other community members are affected, by people in their home environment, in their transport, in their shopping environments, etc. So it's, no one is immune from their social circumstances. So we all need to be making sure that, to behave as if we have COVID and to make sure that we don't infect anybody else. That's probably more important than trying to stop getting infected ourselves.
Yeah, and President Cyril Ramaphosa also did mention that, the country is making some strides in terms of getting that vaccine. We spoke a little bit earlier, Dumelo and I, about how South Africa have received the first COVID-19 candidate application. But at the same time, it is still important for citizens to remain vigilant, because I believe it's still a long way to go before we even do get any kind of vaccine.
Absolutely. Having the vaccine, which is just a phenomenal achievement for the world, that we actually have a vaccine, or in fact a couple of vaccines that work in trials, is that to get it to population level and delivery is just a whole nother ballgame. The logistics involved in distributing vaccines. Remember, at the moment, our vaccine program is for infants, for newborns. And so that's a small proportion of the population. Now we're talking about population levels. So it's a whole magnitude different to be getting the distribution across the country, making sure that everybody has access, cold chain, all of those logistics are just massive. And in fact, even just producing the vaccine. So we really can't rest on our laurels and wait until a vaccine. I think that the saddest part is that the spread of this disease is completely and utterly in our hands in terms of our behavior. We can actually stop it just by wearing our masks, physically distancing, washing our hands, protecting our coughs and sneezes, and just behaving appropriately. We really, really can put a complete dampener on this disease by our behavior.
Yeah, it really is that simple. Thank you very much, Kerrin. We'll leave it there. That was Kerrin Begg, public health medicine specialist, just giving us her reaction to President Cyril Ramaphosa's address.